Connecticut's COVID-19 numbers crossed a concerning threshold this week before backing off a bit. What does it mean? We're asking Governor Ned Lamont.
What are the obstacles to voting in this election, and who is facing them? A national expert from here in Connecticut joins us to explain.
And in our roundtable, a political ad roils a congressional race. Senator Blumenthal plays a prominent role in the Supreme Court confirmation hearing, and Connecticut waits on a COVID relief package.
It's all straight ahead this Sunday, October 18th, 2020.
From Eyewitness News, this is Face the State, Connecticut's most watched local political program.
Good morning, I'm Doobie McDowell.
And I'm Kevin Rennie.
Welcome to Face the State. This is our first broadcast together.
As we begin a new era, we want to acknowledge our friend Dennis House. His generosity by having us both on this show as frequent guests made our new roles possible, and we thank him.
We absolutely do. And let's begin. Governor Ned Lamont has been leading us through an historic public health crisis, and he joins us from the governor's residence. Governor, good morning.
Good morning, Doobie.
Great to see you. How concerned should we all be when we hear the infection rate ticked up this week and the travel advisory at this point may be expanded?
First of all, let me just welcome you and Kevin back to Face the State, a great team that people know all too well. And to reiterate what Kevin Rennie said so well, Dennis House was a trusted member of our family every Sunday morning coming into our homes via Face the State, and we wish him the very best. Look, when it comes to COVID, we knew fall was going to be a complicated time. It's flu season, a lot more interactions, colleges, voting, and we have had a tick up. We're still one of the lowest infection rates in the country, for which I'm really so happy and thankful to the people of Connecticut. But we got to keep an eye on this because it is ticking up, especially in Southeast Connecticut right now.
Can you talk a little more about your thoughts on a travel advisory and what you would like to see that look like?
Yeah, Doobie. As you know, when we initiated the travel advisory with New Jersey and New York, there were maybe, 8 or 9 states that had, 10 infections per 100,000 on current testing. And now there's about 38 states. So we think maybe we should take a look at this travel advisory, not select which states, but just say, look, anybody flying into the great state of Connecticut, either get tested on your way here or quarantine when you get here.
Governor, after 7 months immersed in this pandemic, what are you finding are your most effective tools in capturing the public's attention and then getting them to act on what you advise?
Yeah, that's a good question, Kevin. I can tell you one thing. You can't do things by fiat. You've got to explain to people every day what you're doing, why you're doing it. I can't simply say wear a mask or I'm going to fine you. 99% of the people said, I think it's the right thing to do, and I'm going to do it. And that's why I think Connecticut has certainly benefited compared to an awful lot of our peers when it comes to holding down the pandemic and its potential spread.
The vaccine rollout plans are starting to take shape. I would say I have a lot of faith in our state that we're going to be able to handle this well. Some might have more concerns about the federal government, that leadership has been a bit erratic, should I say. How do you see that being coordinated? And can you give people some hope that the feds are going to be able to lead this effort properly?
I think so. Look, ignore all the loud political rhetoric. I think that the FDA is going to be doing the right thing. CDC is going to be doing the right thing. I think the pharmaceutical companies are stepping forward and they're showing that their trials, they're going to admit their errors when there are errors going forward. We got Reg Eady from Trinity and Deirdre Gifford from Public Health put together a great group of scientific and community leaders. And we're doing that for 2 reasons. One, we're not going to release a vaccine until we all agree it's effective and it's safe. And two, who do we prioritize? Who should get the vaccine first? Those are the two main items that this commission's got time to think about. We submitted on Friday the initial plans we had. Now we're going to hear back from the feds and finalize that over the next month.
Are you satisfied with the discretion that Connecticut will get in determining how to distribute and administer a vaccine?
Well, Kevin, you never know. Sometimes things change a lot and pretty fast down in Washington. Look, we're certainly going to get guidance in terms of what the feds think are essential workers or those who are most vulnerable to COVID. I think there's sort of general agreement that those would be priorities. I hope they're not a lot more directive than that.
What's your confidence level of, or I shouldn't say confidence level, but when do you anticipate that we might have a vaccine? Just knowing the access that you have to information, we've all heard things that are hopeful and then hear them dashed. Care to offer?
So, Doobie, the folks that I'm talking to, a lot of them were part of our scientific advisory group, have said, first, we're going to get better, more accurate, faster, quicker, cheaper testing. That will be the first game changer. Secondly, I think certainly by the end of this year, maybe sooner, some therapies that begin to make a real difference in terms of reducing hospital stays or making sure you don't even have to go to the hospital. And I think finally will be the vaccine. My hunch is you're not really going to see that preliminarily till the first quarter of next year.
Governor, you were the second Democratic governor to endorse Joe Biden's presidential campaign. If he's elected next month, what changes would you recommend in the federal government's handling of general coronavirus policy?
I think we need a real partner, Kevin, in the White House. And obviously early on, if we had spoke with one voice, the White House and the governors and the scientific community about masks and testing and social distancing, that would have been easier. If early on we had had a national strategy when it came to getting all the PPE that we needed. You remember we went running over to China trying to secure our share that we needed so desperately. So I think the federal government will be a partner to the states. I think that's the right role. And also, you know, going back to what Doobie said in terms of credibility, I think you want the White House to be able to say, now is the time. I think this vaccine is safe. I'm willing to take it. You should too. That will make our lives a lot easier here in Connecticut.
Just about out of time, but we're hearing, Dr. Fauci has basically said, everybody, the Thanksgiving plans have got to be low key, and we're all dealing with this kind of thing. Anything that you feel that we can all look forward to this fall or this winter, something to be optimistic about?
I'm optimistic when it comes to the testing and then the therapies and the vaccine that we have a way through this by early next year. I'm optimistic that we're going to be able to provide support for our not-for-profits and small businesses, give them a little more time to power through. I'm optimistic that whoever gets elected, I think you are going to see some relief coming from the federal government, which I think is really so important. So what my job is to tell everybody it's not going to happen tomorrow, and I need you to stay cautious a little bit longer. When you get together with all your best friends and family at Thanksgiving, don't lower your guard, because it's those type of very informal social gatherings where COVID is most likely to spread.
Thank you.
That should be easy advice to follow. Thank you very much for joining us on our inaugural Face the State edition.
Congratulations to both of you. Look forward to working with you a lot.
Thank you, Governor. Voting this year will be very different than it's ever been. Our next guest is talking absentee ballots, voter intimidation, and voter suppression.
And later on the program, our roundtable tackles COVID, a controversial political ad, and Connecticut's role in the Supreme Court nomination hearings.